dapat magpa-newborn screening. Oh, aming baby, isa kang blessing. Kaya dapat magpa-newborn screening. Oh, aming baby, newborn screening.
Magandang araw sa inyong lahat. Good day to all. I am Dr. Carmencita Padilla, one of the proponents of the newborn screening program in the Philippines. Join me in uncovering the wonderful story of newborn screening in our country. Together, let's zoom in on what makes NBS a comprehensive program for every Filipino here at Newborn Screening in Focus. To ensure that newborns are truly healthy, they must undergo newborn screening, a public health program that helps determine if a baby is born with one of the more than 20 congenital disorders. Its importance cannot be overemphasized. If any of the congenital disorders are left undetected and not managed immediately, it can lead to mental retardation and even death. It was integrated into the public health delivery system with the enactment of Republic Act 9288 or the Newborn Screening Act of 2004. Now, part of the PhilHealth's newborn care package, newborn screening is being offered in more than 7,000 hospitals and birthing centers nationwide. It has also saved thousands of children. This educational series is intended for health professionals who deliver services of the newborn screening program. Whether you're online or offline, this program aims to further enrich your knowledge in newborn screening and be able to apply the highest quality service to Filipinos, especially during challenging times. We will discuss the very process of newborn screening from the moment the child is born and into the continuing care available for newborns found positive. We will also zero in on the features and management in each of the conditions included in the newborn screening panel. We will also interview patients as well as their parents. And in keeping up to the challenges, talk over how facilities and centers manage to give quality service despite the limits brought about by the COVID-19 pandemic. This program is the newest educational platform for our newborn screening coordinators. One in every 7,200 health facilities throughout the country. We also hope that this series will also benefit the other health professionals, physicians, nurses, midwives, medtechs, as well as students in the health professions. So take a seat, get comfortable as you're in for quite an adventure here at Newborn Screening in Focus.
Kaya dapat magpa-newborn screening.
Welcome to the 11th episode of Newborn Screening in Focus. In this episode, we will be talking about the DOH regional offices, or called Centers for Health Development, or CHDs, and the role they play in newborn screening, especially during the pandemic. Their role cannot be overemphasized in meeting the overall goal of the newborn screening program, which is contributory in the reduction of infant and under 5-year-old deaths. The CHDs are one of the critical links in maintaining high quality and sustained newborn screening services at the community level. Each CHD has a strong and knowledgeable team of key implementers whose role include program monitoring and evaluation, training orientations to hospitals, health organizations and communities, health information and advocacy, data and records management, patient monitoring and recall, providing support to indigent patients for further tests and for treatment, among others. In this episode, we will be focusing on the challenges faced by the ENDS program and the lessons learned during the COVID-19 pandemic from the point of view of the CHDs. Our guests will be sharing their experiences and discuss how teamwork and collaboration have helped them provide efficient and effective response during this pandemic.
Kaya dapat magpa-newborn screening.
Joining us in this episode are Dr. Monray Isaiah Mansilla, Head of the Non-Communicable Disease Cluster and Newborn Screening Program Manager from the CHD Bicol. Welcome, Dr. Monray.
Diyos marahay na aga po sa Induga Boss, isang malusog, masaya at ligtas na umaga po.
Welcome to Dr. Janet Miklat, Family Health Operations Cluster Head and NDS Program Manager of CHD Central Luzon.
Thank you po. Good morning po to everyone and a very good happy Monday here in Central Luzon to everyone.
And Ms. April Joy Grisones, Regional NDS Nurse Coordinator of CHD Zamboanga Peninsula since 2011.
Buenos dias a todos. Good morning to each and everyone. Here from CHD Zamboanga Peninsula. Good morning po.
Thank you for joining us this in our session today. Just for the information of our audience, ever since we started planning newborn screening with TVUP as a partner, the CHDs have been on board. And I can go back to my conversations with your counterparts way back in 1999. So nagsimula po namin kasama ang mga CHDs way back in 1999 when then Secretary Romualdez actually and together with Dr. Susie Pineda instructed me to start orienting the regional offices. So now moving forward, we're going to talk about how you are engaged in the newborn screening program. So to start our conversation, can each one of you explain exactly what you're doing in relation to newborn screening? Let us start with Dr. Monray. Dr. Monray?
Hi, yes po. At CHD, I am basically the program manager and critical yung role ng isang program manager sa pag-implement ng newborn screening in Bicol region for the reason na majority ng mga technical assistants, program directions, yung mga plans ay create namin at the regional level. Well, of course, with yung kasabay din namin, ini-engage namin yung ating mga local counterparts para mas maging holistic, mas maging applicable yung mga plans po namin. Also, nandoon din po yung mga health education activities po natin. Meron tayong mga ginawang mga webinars, meron po tayong ginawang mga Facebook na series, okay, patungkol po dito sa newborn screening para po kahit yung mga nanay na nanonood, yung mga kapwa po natin mga health workers ay lagi po nating ma-update, no, at makukumusta na rin po kahit po may pandemic. Also, very important na role ng CHD is of course to maintain a very good relationship and partnership with of course our health stakeholders and other partners. Kasi ngayong pandemic, actually po, ang dami palang naging challenges kasi at the regional level, hindi kami masyadong makapunta sa field yet na overcome namin yun lahat with the help of our partners, mapa-NGA man yan, mapa-private man yan, mapa-LGU man yan. So napakaganda pong experience nun at the CHD level.
Thank you, Dr. Don Ronray. You mentioned the webinars. Yan ba ay nasa Bicolano ang inyong mga webinars?
Actually po, madami po kasing dialect in Bicol region. So kaya po ginawa po namin siyang Tagalog para po lahat makakapag-intindi kahit po nasaan man po siyang probinsya.
Naku, napakahalaga niyan. Maraming salamat. Tinungan natin kay Dr. Janet, kumusta naman sa inyo? Ano ba ang naging role naman ng yung position, in the program?
Yes po, good morning po. Similar to what my counterpart has said in Bicol, Doc Monray, for us here in Central Luzon, I'm the head of the family health cluster. And of course, for the newborn screening program, we do have 2 nurses who are really focusing on the implementation. So for at the regional level, we are the actual implementers of the newborn screening program, and we provide technical assistance to not only our LGU counterparts, but also we work hand in hand in collaboration with all our other stakeholders, such as our other government agencies as well as the private sector, specifically in terms of our medical societies. So during the pandemic, we had to come up with new strategies on how we can ensure continuous provision of our essential services, and one of those was the newborn screening. So we were forced to think of new innovations outside the box, but I think in line with our current COVID response of approaching it as a whole of nation, whole of government, whole of society approach, Central Luzon was able to overcome these challenges. And even, I think we have learned some best practices that we can use to sustain our collaborations and strategies, even once we have overcome our current pandemic.
Sige, pag-uusapan natin we'll talk about the best practices later, but thank you. Just like Dr. Monra, ang dami-dami yung ginagawa talaga. I know that that newborn screening is one of your programs. Yun, alam ko talaga. But then, thank you for giving the time. Let's hear from Miss April. Kumusta naman ang inyong role dyan sa Zamboanga?
Yes po, again, good morning. And so, we at the DOH po, particularly at the CHD, our role is to provide technical assistance to our partners through capability building like trainings, orientations. We also conduct monitoring sa ating mga newborn screening facilities, including both the private and the government, hospitals, birthing clinics, and others. So also we provide logistic supports such as augmentations of our expanded newborn screening kits to our LGUs and other government facilities. And also, we assist in our patient recalls, tracking and monitoring of our babies for both short-term and long-term follow-ups. And also, we provide free confirmatory testing to our indigent patients as well as their maintenance medicines. So we also coordinate with our LGUs and other partner stakeholders with regards to the management of their respective patients.
So maraming salamat sa inyong sharing. What is clear to me is that from the time that we envisioned and planned this in 1999, you have kept to the words, to the plan for the roles of the CHD coordinator at the regional level. Siguro, bigyan natin ng pansin itong pandemic, And I'd like to request each one of you to share ano ba ang naging kakaiba nitong time ng pandemic, and then maybe if you can mention 1 or 2 best practices during the time of the pandemic. Start ako kay Dr. Janet.
Thank you once again. So I think some of the best practices for Central Luzon, especially during the pandemic, to continue the provision of our newborn screening services, not only the actual screening of our newborns, but even the other services such as your checkups in the community clinics. I think one best practice, especially during the time of the ECQ, I think this was early in March of last year, April and May. Our newborn screening team actually had scheduled pickups, nagronda sila sa provinces, sila po yung nag-pick up sa mga hospitals ng kits, and they delivered it to our newborn screening center, Central Luzon in Manila City. So because of the restrictions, it was very difficult for the actual kits, the filter cards, to reach the screening center. So this was done, I think, for most of the March, April, and May time period. So we are fortunate enough that because of the service vehicle that has been provided to the region, we were able to continue the services of actually picking up the kits from Aurora to Zambales, our far-flung areas. We were still able to do so. And I think in our current coverage during the pandemic, we're very grateful that our coverage did not really decrease. Aside from that po, I think another good practice that we have in the region, of course, with the coordination of our NSRC and our NSCCL, was the continued provision of training to our newborn screening facilities. Of course, this was done virtually. So we were able to provide newborn screening training and updates to our implementers and facilities through our virtual newborn screening training, as well as our virtual monitoring and evaluation to ensure quality provision of service even despite our pandemic.
Maraming salamat. Now, for our viewers who are not familiar with the program, I just want to inform you that since 1996, from the first day that we started newborn screening, the samples are picked up by the courier service. So lahat po yan covered natin, no? From FedEx, DHL, appointees, JRS, lahat po yan ay kasama ng programa. Kaya po nung nag-lockdown, naging malaking hamon yan para sa ating programa. Kasi nga walang FedEx, walang DHL, walang appointees. And I would really like to thank our newborn screening centers, the hospital coordinators, in coordination with the CHD regions, with the CHD coordinators for making it happen. Kaya narinig niyo, sinabi niya, no? Naglibot sila, nag-pick up sila ng filter card kasi ang makakalakad lang noon ay official cars at saka ambulance at saka mga pulis. Kaya ginawa nilang paraan at sabi nga nila ay hindi bumaba ang kanilang coverage dahil ginawa nilang paraan. Maraming salamat, Dr. Janet. Kay Dr. Monray, anong ginawa niyo? What can you share 2 best practices during the pandemic?
Yes, actually po, Doc, nung nag-pandemic, doon namin na-realize na ang dami palang po pwedeng opportunities kasi na-expose yung mga gaps at lumabas yung mga challenges. And napaka-fortunate ko po with the team ng CHD Bicol, si Ma'am Twinkle, si Ma'am Sarah, kasi po natulungan niya po kaming gumawa ng isang napakagandang business continuity plan to ensure na talagang tuloy-tuloy po yung maibibigay po namin na programa. So dito po sa business continuity plan po ng CHD Bicol, dito po nakita po namin na okay, may malaking gap pala. Tama, yung kanina ni Dr. Miklat, yung logistical support. So automatic, right then and then, we devised actually a very good and concrete na logistical plan. Sinusuyod po. Mayroon po kami mga points kung kailan magpipick up, magpapadala ng mga ENBS filter cards. Nandoon na rin po yung pagpapadala po namin regularly, actually weekly, papunta sa Manila. Gamit po yung vehicle po ng office para masigurado na makakarating yung mga tinest na kits papunta sa Manila at maibalik din po yung result pabalik sa Bicol region. At syempre po, yung kasabay na po dyan yung mga medications, yung mga food supplements po na binibigay din po natin. So lahat po yung serbisyo na yan ay hindi po na-interrupt by the pandemic because of the efforts ng CHD team. Also po, nakagawa rin po kami ng aming Salud Bicol na integrated na program kung saan hindi lang po ENBS ang fino-focus po namin, ini-integrate po namin yung iba't ibang mga programa na mga pangbata na naaayon sa edad. So kasabay na po dyan ang immunization, kasabay na po dyan yung sa newborn hearing, screening, etc. etc. And of course, hindi ibibida ko po din ito. Meron po kaming online na Salud Bicol Academy kung saan po itong online na academy, di ba po, yung usual po natin na mga trainings, seminars, usually dati pre-pandemic ginagawa po natin yan face-to-face. Pero with the pandemic, ginawa po namin yon online, one-on-one synchronous. Ibig sabihin, may lecture, may plenary. Pero po ngayon, asynchronous na po yan. Ibig sabihin, mag-access na lang po sila sa site po at their own time kung saan po sila convenient. Doon po sila makakapag-access ng education na to. And of course, nandun na yung mga certificates na kailangan para hindi po matoxic yung ating mga health workers para po matulungan man lang din po namin sila in one way or another. Also, syempre, nandiyan din po yung pag-maintain namin ng partnership ng aming team. hindi lang sa CHD level, engagement po talaga ng iba't ibang stakeholders. The reason is we really cannot do this alone. We really need partners para ma-implement po ito at para masigurado na hindi mai-interrupt yung services na deserve po at karapatan ng mga bata na mag-receive. Okay, so siguro yun po muna yung masishare kong mga good practices po namin.
Alam mo, maganda yung sinabi mo, Dr. Monray, na business continuity plan. Okay? Kasi in the past, merong sa newborn screening center, meron silang plano kapag nagkaroon ng disaster. But this time, the disaster covered everybody. So dapat talaga meron tayong continuity plan for all sectors, no? And I really appreciate, again, thank you for making sure that the samples reach the center. Kasi yun ang naging dilemma namin noon. No? Para bang nung nagkaroon tayo ng COVID at nag-lockdown, how can it happen? But as you said, if you get all the partners, the stakeholders on board, it can happen. At saka sabi nga ni Dr. Monray, we saw the gaps and we saw the opportunities. So dapat ganun talaga ang ating attitude, no? When you have a gap, ano ang ating solusyon? And you were part of the thinking and the planning. And believe me, when we started writing up the implementing rules and regulations together with DOH way back in 2004, we never thought that that we will be talking about this kind of a disaster. And I'm really happy that the next generation of coordinators are doing their roles. Meron pa isang puntong binanggit si Dr. Monray, yung asynchronous, no? Kumbaga sa klase, pinag-uusapan natin yung synchronous siya asynchronous, no? Pero eto na nga, no? We just had to do an asynchronous, at actually itong ating webinar series ngayon ay isa pang method din ng asynchronous, no? Which means it's going to be archived and you can actually listen to it at your pleasure when your time, and you're either relaxing or doing something else. So maraming salamat, no? And I'm sure that we will have more opportunities as the time goes on. Pakinggan naman natin si Ms. April. Ano ba ang best practices, no? Nabanggit na kanina ni Ms. April na and this is happening in many places, and I'm glad na nabanggit niya, no? Sinabi nga niya na tumutulong sila, lahat naman sila tumutulong, pati doon sa pagbigay ng gamot, pati pagbigay ng card, no? And that's very important, especially in these times na talagang salat. Kasi nga ang ating kino-cover lang ay yung pag-screen, pero paano ang gamot. So, Ms. April, tell us, ano naman ang best practices na i-share mo?
Po, Shansi. So, during the pandemic po talaga, the challenges were overwhelming and our strong linkages were tested during those times. So, especially po nung panahon ng lockdown, na lahat po ng courier services talagang nagsara. So, nasubukan po talaga ang tibay ng newborn screening team, especially po dito sa Mindanao. And most especially po dito sa amin sa Zamboanga, which is geographically speaking, kami po kasi yung nasa dulo going to Davao. So, and by land travel po siguro it would take 1 to 2 days po bago makarating ang mga blood samples doon. So, humingi kami ng tulong sa NSC Mindanao at sa tulong po ni Doc Conch, ang head po ng NSC Mindanao, lumapit po ako sa kanya, no, asking for help, and siya po talaga ang nag-initiate. So she sought assistance sa LGU po ng Davao, and in response po, Mayor Sara called up our LGU, si Mayor Beng Climaco, and asked him kung pwede kaming tulungan na maipadala ang mga blood samples namin sa Davao without delays. So he asked me, how can they help us? So we told them na if pwede bang makipag-coordinate sila sa Philippine Air Force, sa Edwin Andrews Air Base po namin dito, para ma-ferry po namin ang mga blood samples from Zamboanga City to Davao and vice versa. Humingi din kami ng at least once a week na flight schedule po para sa fly out ng mga blood samples. So thank God, immediately yung request namin, nag-grant naman po, and we were informed na nakabook naman kami ng weekly flights para sa pag-send out ng mga samples, and we just have to coordinate with our Western Mindanao Command. So every week naman may available flights. So in-inform namin ang mga newborn screening facilities, we coordinated with them, and we also designated yung mga drop-off points bawat probinsya po namin. So like sa Zamboanga City, we have coordinated with Zamboanga City Medical Center and BGH or the Basilan General Hospital naman po for Isabela City, Zamboanga del Sur Medical Center for the province of Zamboanga del Sur, Zamboanga del Norte Medical Center naman po for Zamboanga del Norte, and also kasi wala pong masyadong access ang Sulu, we also covered them. So some part ng bar na cover din po namin sa Sulu. So lahat po ng DMOs namin, our provincial coordinators and hospital coordinators, nagtulong-tulong po kami sa pag-schedule ng aming mga blood samples delivery. So like every Wednesday po yung in-schedule naming flight to Davao sa blood samples. So minimake sure namin na before Wednesday or Sunday or Monday, nasa kanya-kanyang drop-off points na po kada province yung mga samples para po ma-deliver ng mga drivers going to Zamboanga City the day before or early Tuesday. Para pagka Wednesday po, lahat po ng mga blood samples are ready on hand for the flight to Davao. So, ang ano naman po namin is, pag nagpapadala po kami sa Davao ng mga blood samples, kino-coordinate din namin sa mga PDOs nila doon, and then in return po, pag may mga kailangan din po kami like the kits, gamot, gatas ng mga patients, pinapadala din po nila if may mga return flights naman po dito sa Zamboanga. So all this information po were posted online. We made an FB page para po sa lahat ng mga Zamboanga Peninsula health workers. So lahat po ng communications, nandun po lahat. We text them, we chat them, we call them. So always po, ang masasabi talaga natin that communication is the key po talaga to all information. At para magkaintindihan po lahat ng mga stakeholders. And most especially with the full support of our management from the Zamboanga Peninsula CHD. No, like from RD Municipio now to RD Josh, Brillantes, to ARD Alpici, Engineer Saya, Dr. Acheng, and to all the LGUs who have coordinated and supported us with this.
Maraming salamat, Miss April, no? Nakarating pala ito hanggang kay Mayor Sara. But you know, this is the kind of dedication that I really am getting. You know, I have so many stories already I'm hearing about how each of the hospitals, each of the CHDs have put it together. Ang gusto ko ma-appreciate ng mga nakikinig sa atin na para mag-succeed talaga programa, kanya-kanya talagang pag-iisip ng solusyon, no, in the time of pandemic. At nakita nyo naman na kung dati hindi natin pinoproblema ang pick-up, naging problema siya ng ating 3 bisita ngayon, ano? Yung pick-up ng samples at pagdala ng mga gamot sa mga pasyente. At sa araw na ito, narinig natin na ang kausap nila ay Air Force. Gusto ko lang malaman ng ating viewers na nung unang panahon, decades ago, hindi naman ganun katagal, you know, Batanes lang ang problema ko. Kasi Batanes lang yung nasa island, no? Pero parang na-solve namin yon. And then all of a sudden ngayon, naging problema siya ng lahat kasi nga nag-lockdown. Gusto ko ipaalam sa lahat na hindi kami nagbayad sa Air Force. Tama ba ako, Miss April? Lahat po na nakinontak ng aming coordinators, whether it's the Air Force, the military, or the Navy, lahat po yan ay kanilang binigay. So ang highlight talaga dito sa sharing naman ni Miss April ay yung getting on board. Actually, lahat sila nag-share eh. Hindi kasi kayang isolve ng isa. So to make it work, you've got to find out kung sino yung mga links, and then just do your part, no? And then if you have to go higher, then go higher. In this case, they realized that they had to talk to the mayor, so that, you know, they can get the system going. So saglit na saglit lang talaga yung naging problema natin kasi nga on board ang ating coordinators. So ang nakikita ko ngayon ay nabanggit na ito ni Dr. Monray kanina, no, integrating newborn screening in the total package of education. And yun naman din ang gusto kong mensahe sa lahat ng nakikinig sa atin ngayon na yes, we may be dealing with we may be talking about newborn screening, pero kapag kasi nasa DOH ka, hawak mo lahat eh. At isang na-appreciate ko talaga in the past 20 years ay, the efforts of DOH to integrate this in their educational programs. So, 20 years ko nang kapartner ang DOH because DOH came on board actually in 1999. Even before the law. So gusto kong paalam lang sa ating mga nakikinig na si Secretary Romualdez. So kung nung panahon, nung 1999, balikan natin ng konting storya. Nung 1999, si Secretary Romualdez, nung siya'y pag-upo niya as a secretary, ay kanyang inatasan si Dr. Susie Mercado, yung host natin sa TVUP, to actually talk to me and discuss how are we going to get the regions engaged. This was before the law. And that was the beginning of our tours to the different regions. And then eventually when the law was passed, kasama ko na talaga mga CHDs. At kasama sila sa pagsusulat talaga ng implementing rules and regulations, all the manual of operations. Ang mga kasamahan ko sa DOH na yung generation, nung time ko, nung nagsisimula ako, yung mga CHD coordinators, marami sa kanila ay retired na. Okay? Pero nararamdaman ko na buhay pa rin ang spirito ng dedication to the newborn screening among the CHD coordinators. Hindi talaga nagkamali at hindi nagkulang ang DOH sa kanyang pagsuporta sa programa. So ngayon, ito naman mapunta naman tayo sa mga darating panghamon, no? Kasi ang nakita ko in the past 12 months, kayong tatlo ay nakita nyo ang inyong mga hamon, ginawa nyo ng paraan, kayo'y nag-succeed, kaya kayo ay ating bisita sa araw na ito. At alam ko na marami pa kayong mga ibang mga hamon pa na hindi na ibahagi ngayon kasi sa kakulangan ng oras. At huwag kayong mag-aalala, gagawa natin ng libro yan para lahat ng inyong kwento ay maisulat. Pero ngayon naman pag-usapan natin, ngayong better normal na, pag-usapan naman natin yan. Ano pa ba ang nakikita nyong darating na hamon? How do you envision the program? Kasi ang tingin ko, this is it eh. Ito na yung ating better normal eh. Ano pa ba ang mga parating? How are we going to implement newborn screening during the better normal? I'll start with Dr. Monray.
So, in the better normal, actually in CHD Bicol, from the strategic framework po ng Central Office, basically nagkaroon din kami ng regional newborn screening program na mga strategic plan or operational plan. So ito actually yung gusto namin ma-reach in the better normal. No? So nandiyan na po yung gusto po namin ma-screen talaga 90% ng live births in Bicol region maybe by 2025. No? So ang tina-target namin talagang yearly nag-i-increase. Kahit ano pa man yung konteksto na ginagalawan, solve natin yung mga gaps na yan para ma-achieve natin na lahat ng bata ay talagang makuha nila yung deserve nila na mga tests or programs. No? So also by 2025, we plan na syempre gawing quality yung service din po natin by of course pinapababa natin yung mga unsatisfactory samples, no? So gusto natin maging malinis, ma-smooth yung maging process para quality yung ibibigay natin na serbisyo lagi. Also, gusto po namin mapatindi pa lalo yung monitoring and evaluation. This way, magiging engaged pa po, makikita po yung CHD, yung makakapagbigay po tayo ng mas madaming technical assistance doon sa mga implementers po natin. At this pandemic po kasi nakita po namin na very critical pala na yung support, yung emotional support ng someone na yung group basically para ma-feel mo na belong ka sa group, ma-feel mo na kung nanghihina ka na ay lalakas ulit yung loob mo kasi marami pa pala kayong magkakasama na lumalaban. Okay? And also, nandiyan din po na gusto po namin makapag-set up in Bicol Region ng isang new NBSCC. Okay? And of course, gusto din po namin ng NSC na ma-establish dito sa Bicol Region. So we're actually working very hard. We're working double time para po ma-achieve namin itong mga regional targets po namin. Well, syempre, using the risk-based thinking, nandoon na rin po yung tinitingnan na po namin ano yung mga usual na posible namin ma-experience gamit along the process. Kasi again, dumadami yung challenges. But again, ang lagi ko pong sinasabi and lagi po naming mindset sa team, yung may lessons kami. Number one, you need to learn, to know, to acknowledge na may problem. That's the very first thing. And of course, kailangan ang susunod na hahanapin mo doon, ano yung pwede natin gawin sa problema na yon. Kasi hindi tayo susuko. Susolusyonan natin yan. And of course, yung second lesson po natin, we always need to do all things we do beautifully. Dapat laging quality. Dapat laging beautiful yung piniperform natin. And also, syempre, always help. Yun yung third namin. Always help. Lahat tayo may pinagdadaanan, lahat tayo merong challenges na kinakaharap, but very critical sa performance po natin na maging maganda yung partnership ni DOH and all other stakeholders, of course. And yung isa pa na usual naming sinasabi, always do things with love for love. Okay? Kasi kapag love mo yung ginagawa mo, love mo yung pinagbibigyan mo ng serbisyo, naku, kahit pagod na pagod ka na, kahit Saturday, kahit Sunday, ginagawa po naming Monday para mabigay yung mga serbisyo na yan. So yun po sa Bicol Region.
Thank you, Dr. Monray. So, summarize ko lang yung sinabi ni Dr. Monray, no? Ito yung mga darating pa nilang hamon during the new normal. Alam na nilang meron pang mga darating na hamon, kaya nga magkakaroon sila ng regional strategic planning. At narinig na, kasi nakikinig dito yung mga ospital mo sa Bicol, Dr. Monray, aabangan mo ang mga ANSAT natin, ha? Bawal na ang ANSAT. So, para yung ANSAT, ay parang sa mga nakikinig na hindi alam pa ng ANSAT, ang ibig sabihin nun yung sample na sinabit ay hindi maganda. So, may targets ang kanilang region na dapat talaga wala na tayong ANSAT. And they will continue to, provide technical assistance. At napakaganda itong part nito, no? Na hindi ka nag-iisa, na kasamang emotional support. I'd like this to happen in every region. Okay? Kasi masyadong malaki na pag-national eh. So sana nga, no, let's do this. That we do not provide only technical assistance, but also emotional support. Aabangan ko ang Newborn Screening Center sa Bicol at ang Newborn Screening Community Clinic. Dr. Monray, isang dekada na yata ako nag-aabang dyan ng Newborn Screening Center sa Bicol. Baka pwede mo naman akong tulungan. Gusto ko na talaga magbukas by next year. So if you can help me look for a place, I will go there and visit and then, help you out. Yung kanyang lessons ay gusto ko yung last part niya. Do love with love. Okay? Do things beautifully. Alamin natin, talagang acknowledge natin na may problema at nothing is perfect. Okay? So, kung tatandaan lang natin lahat yon na marami pang pwedeng gawin, bakit hindi? Okay? So, ganyan haharapin ng Bicol Region ang new normal. Maraming salamat, Dr. Monray. Let's listen to Dr. Janet. Paano ba ating new normal naman sa Central Luzon?
Yes po. For Central Luzon, the new normal or the better normal, with our hope of our vaccines, our COVID-19 vaccines. I think for Central Luzon, our better normal, aside from learning from our challenges, the opportunities that we took, to gain from those opportunities and the lessons learned, aside from sustaining the collaborations and commitment from all our other stakeholders, especially the private sector, particularly our medical societies, not only of the PPS, our Philippine Pediatric Society, but even our IMAP, our Integrated Midwives Association of the Philippines. Aside from maintaining and strengthening these collaborations, I think for Central Luzon, our better normal will now be to engage more our local chief executives, not only our local chief executives, but even our local officials up to the barangay level. Because in implementing our newborn screening, they do have a very vital role, not only in raising awareness and advocacy of the program, but even we have seen during our pandemic the vital role of our local officials, like our barangay tanods, our SK, in following up our patients even in Central Luzon, and they are very mobile, especially now. So one part of the program is not only screening our newborns, but even once they are screened, we shall maintain and continue our services during the continuity clinic. And a part of that is the community engagement with them to sustain their medications, their routine laboratories, and the supplemental food supplements. So our better normal for Central Luzon is engaging more our local officials, not only our local chief executives, hopefully to for their role in the local investment of newborn screening. We have seen for our other programs, especially our immunization for Central Luzon, we had outbreaks of some of our vaccine preventable diseases, not only last year, such as our measles, rubella, as well as our polio. So engaging our local chief executives in their role, not only in local investments, but also in the transportation and other services was very important. So hopefully for newborn screening, we can also do the same, even up to the level of our barangay officials, because they are very important in the community engagement, not only of our patients, but also of our parents. So that is the better normal for Central Luzon.
Maraming salamat, Dr. Janet. In addition, ang napakaganda ng isang binanggit niya, yung engaging the local chief executives, including the barangay officials, barangay tanod and SK. And I also sustaining the collaboration with the private sector, the medical societies na tutulong sa inyo naman sa paggamot na sa mga pasyente. Gusto ko lang banggitin sa inyo na nung nagsisimula ako ng newborn screening, ang binibisita namin hanggang barangay level. Ang aking mga kinakamayan ay mga barangay captain at saka mga mayor. Meron pa ako mga litrato niyan. Kaya tama yan, when we talk about sustaining the program, it cannot only be at the level of the hospital or at the level of the birthing center. If you're talking about sustainability at the community level, yes, we can do this. So once again, this is a best practice that we'd like to encourage everybody to consider. Go down to the level of the barangay. Naalala ko pa noon, alam nyo, kapag yung mga barangay sa pinupuntahan ko, kasama ko yung mga barangay health workers, tsaka yung mga nutrition scholars, tas suot nila lahat yung t-shirt ng newborn screening, nakakatulong yun talaga. Kasi it's one way, advertising the program. So, kadagdagan yun sa ating mensaheng dadalhin ngayon. Let's go down to the community. Let's go down to the barangay. Kasi alam nyo, marami pa tayong hamon sa better normal ngayon. Kasi hindi ko pa alam kung ano mangyayari sa next year. Pero naniniwala ako na kapag talagang on board lahat, mahirap talaga tayo tumbahin. So thank you Dr. Janet. So tingnan naman natin, paano ba ang better normal naman ngayon sa April sa Zamboanga?
Yes po, Doc. So, alam naman natin talaga that the newborn screening does not end at screening alone. So, the most challenging part po is the patient compliance po talaga, especially under treatment. So, we have already noticed this pre-pandemic phase pa po. So, kaya nga po, during my masteral in the Development Academy of the Philippines, sa DAP po, I really took the opportunity to find an innovative way na makatulong to improve our patients' compliance, especially on our long-term cases. So, in coordination with the Newborn Screening Continuity Clinic, headed by Dr. Elyong, we have conducted an orientation for the MHOs, doctors, including private pediatricians po sa provinces with their newborn screening coordinators para po sa long-term care and management ng mga patients. So this was a venue to inform them of the long-term cases sa kanilang mga respective municipalities and cities, and that these patients really need their help on their long-term treatment. So we aim to reach out the local healthcare providers kasi hindi po talaga kaya ng newborn screening continuity clinic alone dito sa Zamboanga City na i-manage yung mga patients namin sa buong region. So which is especially malayo po talaga ang mga probinsya dito mismo sa capital ng aming region. Kaya inilapit po namin ang continuity clinic sa mga pasyente and para sa continuity of care. So, nilapit namin sa mga RHUs. Kumbaga parang it's more of an idea of the satellite clinic, hindi sa provinces, but doon po mismo sa RHUs, sa munisipyo po mismo. Kasi especially during pandemic na nahihirapan ng mga patients na mag-travel. So, instead na pupunta pa sila dito sa Zamboanga, doon na lang po muna sila sa kanilang mga munisipyo through their RHU sa kanilang mga MHO. So, sina Doc po and the NDS coordinator, sila po ang tumitingin sa patients, and then if may mga further complications or mga further referrals naman, nire-refer po kay Dr. Elyong dito sa Continuity Clinic. So we coordinate them through the teleconsultation doon po sa mga provinces, especially doon sa mga patients na nasa GIDA area and sa dulong-dulo po ng bundok na walang signal. So ini-schedule po namin sila na pumunta ng RHU at doon po namin kinakandak ang aming teleconsultation. And we established diagnostic centers po sa mga per province po yon, and we have MOA with them para in case na may mga monitoring po ng mga patients ay makapagpunta po ang mga patients doon for free. Charge po sa amin dito sa CHD. And also we coordinated sa LGU para to meet halfway, no? So kami sa monitoring test, sa gamot, and sa lab test. So, ang LGU naman po ang inaano namin sa transportation po ng mga patients during monitoring. So, ini-schedule po para ma-providean po sila ng transpo going to the laboratories.
Maraming salamat, Ms. April. No? So, maganda ito kasi iba naman ang tinukuyan niya. No? Compliance with treatment, and then engaging the municipal health officers, and bringing on board private physicians dahil nga nalalayo ng mga pasyente nila. Meron akong hamon na ibibigay for Bicol, Central Luzon, and Zamboanga, and that is the development of satellite continuity clinics. No? Sinimula na ito bali ng Western Visayas. Ang Western Visayas ay nagtayo ng 15 satellite clinics para sa kanilang mga pasyente na malayo sa main clinic. And I think, we can come up with this kind of ideas to move forward. Ang hirap kasi sa Pilipinas kasi tayo, archipelago tayo. No? So maski ano pang sabihin mo, isang region ka lang talaga, napakadami talaga. So sa tatlong sharing, makikita nyo na yung picture nila ng better normal ay parang lahat talaga kailangan kasama. Dr. Monray talked about, on the regional level. Dr. Janet was talking about collaboration with the private sector. Ms. April was talking about compliance. So, gaya nga ng ating natutunan doon sa earlier episodes, di ba? Ang sabi ko nga doon sa episode 1, it's a system. It's a system, and the whole system has to be working. Hindi talaga ito magsasucceed kung isa lang talaga ang magtatrabaho. So ako'y nagpapasalamat sa inyong dedication na napapatuloy nyo ang spirito ng newborn screening. Ako, napakabilis ng ating oras. I'm sure what you have shared is only the tip of the iceberg, no? At sabi ko nga, hindi ito ang katapusan. Pero sa ngayon ay oras na para magpaalam, kaya hihingi ako sa inyo isang huling mensahe. Start ko kay Dr. Janet. Dr. Janet, anong mensahe mo para sa ating mga nanonood?
For Central Luzon, we have seen what works, especially during our pandemic, and that is working as one to reach our goal for better health outcomes of all our family members, especially our newborns. So for Central Luzon, let us continue to work together, collaborate, and be committed to improving the lives of our newborns through our expanded newborn screening to prevent mental retardation and death. Thank you. Good morning po to everyone.
Thank you. Dr. Monray?
So basically po, madami pong challenges na tayong kinaharap at madami pa po tayong challenges na kakaharapin in the future. Okay, so for keep ang pinaka-tip ko po sa lahat for the healthcare workers is first, take care of yourself. Always take care of yourself kasi pag hindi nyo po inalagaan ang sarili po ninyo, mawawalan po kami ng isang napakagaling at napaka-critical na role na ginagampanan nyo po, no, para ma-maintain at ma-provide po natin yung services na binibigay po natin sa community natin. So nandun at the start of the pandemic kasi we are very all out, we are very ginagawa po namin lahat, no, para lang sa makapag-serve. Pero nakakaligtaan natin na oops, kailangan ko din palang alagaan yung sarili ko. Kasi kapag nawala po yung sarili po ninyo, ay nako po, mawawalan po kami ng magaling na health worker. Okay? So alagaan niyo po yung sarili po ninyo. Sa mga mothers naman po, ang paalala ko po sa inyo, ngayon po na may pandemya, naku, kailangan po natin lalong i-achieve or i-avail yung lahat ng mga services na po pwede po makuha ninyo, ng mga miyembro ng pamilya ninyo at ni baby po ninyo. So ang newborn screening po kasi ay malaki ang magagawa po para sa baby po ninyo. Kasi po kapag meron pong palang sakit yung baby po ninyo, hindi natin na-diagnose agad kasi hindi na newborn screening, naku po, baka po malate po yung management po natin, mas maging mahirap po, lalo na po may pandemya, yung mga referral, etc. So ang tip ko po sa inyo, sa mga mommies na nakikinig, sa mga lolo, lola, sa mga buntis, ay naku po, as early as now, tingnan nyo na po. Iplano nyo na po, kailan ako magpapa-newborn screening? Ano ang newborn screening? Ano ang newborn screening? At ano pa yung mga health services na dapat nyo pong makuha sa edad ninyo, kay baby ninyo, sa mga kasama po ninyo. Again, dapat total po yung package na makukuha po ninyo kasi ang isang strategy lamang po ay hindi enough para po ma-beat ang COVID. Kailangan po lahat. Palakasin po natin lalo ang sarili po natin. Okay? Gusto ko lang pong balikan yung mga health workers na actually lahat, in general population po natin na hirap na po ngayong pandemya. Gusto ko po kayong paalalahanan sa pamamagitan ng isang kanta. Napakaganda ng kantang ito, yung lyrics, no? Dahan-dahan nating simulan muli ang paghakbang. Dahan-dahan nating tumingin at dahan-dahang tumingin sa salamin upang makita ang ating kagandahan. Dahan-dahang iangat ang mukha upang masilayan ang payapang kalangitan. Oo, pagod ka na, pero di ka nag-iisa, kaya lumaban ka at sabihin, tayo naman muna. Yun lang po. Maraming salamat po.
Maraming salamat, Dr. Monray. Miss April?
Yes, Doc. We can absolutely say that no man is an island. It's always a teamwork with guidance, and intervention. So as health workers, we are looking forward to a better coverage of expanded newborn screening more than the pre-pandemic phase, not just in quantity, but in the quality of care we can give to our babies. That more can be saved from mental retardation or even death. And on the side of the parents, especially the mothers, we would like to take this as an opportunity for them to overcome the fear and access and appreciate the newborn screening services in our facilities. And muchas gracias and vaya con Diyos.
Maraming salamat. Maraming salamat sa ating speakers. Sabi nga nila, work as one, teamwork, take care of yourself. We need you. At maski meron pandemya, huwag kakalimutan ang newborn screening. Maraming salamat sa inyong tatlo.
Kaya dapat magpa-newborn screening. Newborn screening.
In episode 5, we heard from the newborn screening centers how they quickly stepped up to respond and coordinated mitigation plans effectively. Today, we listen to the strategies implemented in different regions. We learned how the CHDs have become innovative with their efforts and responses to unique challenges brought by the pandemic. We are thankful for the hard work and dedication put forth every day by the newborn screening teams in the 17 DOH regional offices or CHDs. With so many individuals and organizations extending help, over time, these teams were able to adapt, stay creative, and productive to continuously provide quality services and support for the newborns and their families. Thank you very much to our guests today, Dr. Janet, Dr. Monray, and Ms. April. Maraming salamat sa inyong tatlo. To our virtual audience, please send us your comments, questions, or the list of topics that you want us to cover in our succeeding episodes. Email us at info@newbornscreening.ph or you may tweet us at newbornscreening.ph and also include hashtag ENBSPH. Before we end, I want to again take this opportunity to present to you the new addition to our tools in learning, the ENBS mobile app. The ENBS mobile app is a one-stop hub for all NBS health workers on everything they need to know about newborn screening. It also features a rewards program that our health workers can use to earn points and use it to claim shop vouchers with our partners. If you have already downloaded the app, answer the quiz that we will send to your inbox to earn those points. We continue to improve our services as deemed necessary by the emerging challenges through an open dialogue about our experiences in newborn screening. It is our hope that through this video series, we extend the sharing of knowledge with greater reach, empower our frontliners, improve connectivity with the newborn screening coordinators, and most importantly, provide unparalleled service to every family. For our next episode, we will discuss different scenarios which may affect NBS results. This and more here in Newborn Screening in Focus.
Mula sa sinapupunan, 9 na buwan ka naming inalagaan. At ngayon, nandito ka na, di ka namin pababayaan. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Love na love ka namin, kaya ito gagawin. Para sa kalusugan mo, dapat natin tong sundin. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening.
Napakadali ng process na magpa-NBS. Ilang patak ng dugo ang kailangan para magawa ang test. Makalipas ang 24 oras, pag si baby lumabas, gawin natin ng NBS, alin sunod sa batas.
Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Newborn screening. Newborn screening. Newborn screening. Para sa iyo rin to, sa kalusugan mo.